Cynthia, there has been a lot happening here at City Hall today. It started with Mayor John Tory thanking Premier Doug Ford for helping replace 200,000 faulty face masks that were eventually recalled as a result of them starting to tear and rip. There is an investigation taking place into what happened there, but it turns out they were used at two separate long-term care homes by 220 staff members. We'll find out more about that in the coming days. As for other focal points today, one has included focusing on the city's less vulnerable or more vulnerable. Advocates for the city's homeless are speaking out about conditions in shelters tonight. They showed up at City Hall outside in Nathan Phillips Square saying despite repeated calls for more physical distancing and better screening at multiple shelter locations, not enough is being done. One case of COVID-19 was confirmed at Seton House yesterday. There are now 8 in the shelter system. City officials say they're moving people into hotels as quickly as possible in other locations, despite complications in logistics.
We hear the stern warning he gives Torontonians to practice physical distancing and self-isolation, and we take that advice seriously. But it is imperative that his own administration take that advice seriously and move people out of these shelters and move them into hotel rooms now.
To this day, to this hour, despite requests, the medical officer of health has not issued an order for physical distancing in shelters when it comes to beds. Nor has she done an order that inspectors go out and ensure proper screening is happening as people enter. And honestly, you just have to walk into any one of these sites in the city and you will see an outbreak ready to happen. It was always there and it's worse now. We're learning how contagious this virus is.
I will reiterate that we have been doing this for a number of weeks and we have had a number of actions that we've been taking. So we did create physical distancing in our respites first by very rapidly opening programs in community centres.
At this stage, there doesn't appear to be any merit or need for an order to be given. And as you've heard us say from this table many times, that effective public health measures are best done on a voluntary basis.
Now, the scenario involving COVID-19 cases at the Seven Oaks long-term care home is also getting worse. Dr. Eileen de Villa now says there are 45 people confirmed with the virus, 56 probable cases among 249 residents. Several staff have also tested positive despite increased measures being put in place.